Speak sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What saturated fats really do to your heart. A diet high in saturated fats, like red meat, palm oil, and whole milk, can raise cholesterol levels. Research shows that replacing saturated fats with unsaturated fats can reduce the risk of heart disease, especially for people with high cardiovascular risk. The new Dietary Guidelines for Americans highlighted saturated fat sources like beef tallow and butter, raising questions about how this aligns with recommendations to limit saturated fat intake. People at high risk for heart disease who replace saturated fats with polyunsaturated fats have fewer heart attacks and other cardiovascular issues. Saturated fats can raise LDL bad cholesterol, which contributes to plaque buildup in the arteries. The overall evidence shows that reducing saturated fat intake benefits those at high cardiovascular risk, but the effect is smaller for those at low risk. The latest dietary guidelines recommend limiting saturated fat to 10% of total daily calories, but minimizing saturated fat intake is more important than focusing on percentages. Saturated fat is neither good nor bad. The overall dietary pattern and personal health risks determine its impact on health. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs. Less than /speak.